either the hypothenar, or is that the thenar? Whichever one, this eminence. I have it on the anterior of the fibula, and I have the hypothenar eminence on the posterior of the tibia. And my motion is this way. That's going back, this is coming forward. Often you can hear a little noise there, sometimes you can't. Second, my left hand is merely stabilizing the foot so that if there were a line through here and the knee, those lines would be parallel. And that's the way I'm holding the foot this way, with my left hand. With my right hand, I'm pulling plantarward on the calcaneus and moving it medialward at the same time. And that's for the elevation of the anterior aspect of the calcaneus. Comes down, rotate it medialward. Then you go to the talus. You feel directly under the medial malleolus. Go just slightly ahead of the first little flat spot. Your finger on the lateral aspect is just under the head of the fibula. And the motion, this hand acts like a wrench. It's got to be very firm. And you just press firmly, no jerking. You can often hear this one go. I can hear this one go right now. As the talus moves over the superior aspect of the calcaneus. Then when you think you have that all in place, then you go to the other tarsals. Now I'll be moving the navicular, the first, second, and third cuneiforms, first, second, and third metatarsal shafts. I'm merely stabilizing with my right hand, once again to keep this line straight with this line, not straight but parallel. So I'm just pulling out gently on the calcaneus. This hand rotates toward the midline of the body. They made some nice noise.
That was lovely.
Then I always feel to see if there are any slight subluxations. It's still slightly tender there, right there. Yeah, it is.
Yes, it is.
Right there. You can feel
Yeah,
it.
yeah.
So then I move the navicular singly. I move the cuneiform singly, the first cuneiform, and the first metatarsal shaft. Then you feel again, and then discover it's gone. Then I pull distally on the second metatarsal shaft. I have this finger, my index finger, is on the second cuneiform. So I'm pulling outward, I'm pressing with this finger down, rotating the second metatarsal shaft medialward. Then I go over to the third. This finger's on the third cuneiform. This one is pulling it distally and rotating it medialward. Then, from there on, all you have to do is lift the cuboid. Try it this way first. I have my hand around it. I have my third finger on that cuboidal lip.
Oh.
It makes a little noise here and there. Resembles a herd of crickets. Then I pressed it from the other side on the same point. Then to make certain that it's nice and firm, I'm pressing with my thumb on the bottom. Now you notice all the paint's gone.
Yeah. Oh, yeah.
Then foot strapped. Generally an orthotic. It all depends on how long the bones have been subluxated. And if it's unilateral, or if it's from an ankle sprain injury or something.
46
Because
years.
a lot of people, you don't really need to make orthotics. I'd say there are many more people I do not make orthotics for than there are that I make them for.
How do you determine?
If they stay real well with just adhesive tape, and I can feel It'll be usually a unilateral one that might have been out for years. The other foot's perfectly okay. That's probably from an injury, and usually from an ankle sprain, because this whole series of events occurs virtually every ankle sprain, unless you have a medial ankle sprain. Then it's different. But for 99% of all sprains, what I did now is the way I manipulate for a sprain, or for a heel spur, or for a neuroma, or for plantar fasciitis, or fasciosis, or whatever you want to call it. The manipulation is exactly the same. You stabilize it, because the etiology for all of those things, in my view, is an increased lower surface angle of the talus, which allows excessive pronation to occur. Because as the talus over-rotates, the head of the talus subluxates the anterior aspect of the calcaneus. When that's brought down, this lip on the front of the calcaneus is what subluxates the cuboid. And that whole series of events occurs in a moment.